have a dentist today that will do justice to this topic, and her name is Dr. Wuraola Okedia, and she is here live with us today. So whatever question you have, don't worry, I'm very sure she's going to do justice to that question, and she's already here with us. Good morning, how are you?
Good morning, I'm fine, thank you.
I would like to ask, what is your own take? Like, can you share, personally, like you now, can you share your toothbrush with your partner?
No, I can't.
Why?
Well, it's personal hygiene. It's something personal to me. Should we now delve into it?
Yes, please.
Okay, so we would say we kiss our partners, we drink from the same cup, we use the same spoon to eat. So what's the big deal in sharing your toothbrush, right? But you know, the toothbrush does a dirty job.
Yes, it does.
So it cleans your mouth and cleans the debris, the bacteria in your mouth. And that's actually the work of the toothbrush.
Okay.
And for some people, they brush rigorously and they might even bleed while brushing.
I said it. I said it. I'm not friends with her, so don't think we've had this communication before. You know, she's my friend, definitely, but I'm just seeing her for the first time. So, you see, let's go on.
Yeah, so yeah, they might bleed while brushing. Some even have gingivitis, like a medical, it's not something serious, like you have, the gums are just infected, they are inflamed. You know, once you don't do your professional cleaning, your gums get inflamed. So you bleed while you brush. On any little trauma to your gums, you bleed. Some people might even have sores in the mouth, like ulcers in the mouth and all that. So I pick up my spouse's toothbrush. It has, let's say it has gingivitis or is bleeding rigorously, and I use it to brush my teeth. I don't think it's right. Because like I'm introducing the bacteria from his mouth into my mouth.
Your mouth.
And you know, so this thing, like, there's already blood on his toothbrush. So the thing could get into my own system too. God forbid, let's just say he has hepatitis, HIV. You're introducing that into your system. So it's not ideal. No dentist would recommend you sharing toothbrush.
Okay, so I'm really curious because we asked a lot of people, and you know, their own claim was, I mean, is your partner number one? You guys kiss a whole lot. So if sharing your toothbrush with your partner can cause you to have some certain bacteria, right? I mean, what about kissing? I mean, you kiss your partner a lot, you guys exchange saliva. Doesn't that also, you know, invite bacteria? So my question now is it also, like, can you get your partner's bacteria and all of those things even through kissing?
Yes, you can.
Which is worse, toothbrush or kissing?
You have more risk with toothbrush.
Okay.
You have more risk of contacting bacteria with toothbrush. You know, like I said, toothbrush does a dirty job.
Yes.
Like now, so if your partner, like, there are some periods you shouldn't probably kiss. If your partner has cough or has sore throat, and you would most likely contract it. But with the toothbrush you are doing, you know, some people go as far as brushing into their throat and all.
I mean, the toothbrush gets to every nook and cranny.
Yeah, so you're introducing that bacteria into your mouth also. So it's not ideal to share your toothbrush with your spouse.
So what about in a situation whereby you go visit your partner and you forgot your toothbrush, right? Can you make an exception for that, or you should just completely avoid it? And if your take is to completely avoid it, what are the other options that such a person can do? Because a lot of people said, okay, what if I forget my toothbrush and I'm going to spend the weekend with my partner? What then can I do? These are people's questions, so I want you to answer this. Okay,
yeah, so the first thing for me, I would just not use your toothbrush to start with. I'll wash my hands. And I'd rather use my hand, apply toothbrush and
toothpaste.
Yeah, toothpaste rather, and just clean off just for that moment. I'm not going to spend your house
forever.
Even if it's for a whole week and you didn't bring your toothbrush, you can always go to supermarkets and get yourself a toothbrush.
Well, some said, okay, what about it's a location whereby they don't sell toothbrush? I mean, maybe a rural, you know,
or let's say you
location,
and you are
and you're new
somewhere
and you don't know the environment. What about something like that?
It's still not advisable. It's still not advisable to use someone else's.
Okay, but
toothbrush.
Say it's for a week now, right? And then you're using your hand every time to brush your teeth. I mean, bad breath and everything.
You can't do that for a week, definitely.
Okay.
You shouldn't even do that for a week. But you should just, maybe cotton wool or something, you can just try and improvise.
Sure.
But I won't advise someone sharing toothbrush. Even mothers with children, it's not advisable. Oh, you can say this is my baby and all that. It's still not. You are going to introduce a lot of bacteria that was probably not in that child's mouth. Because you know, normally we have bacteria in our mouth, even on our skin. They are just normal there, and they don't, you know, do harm, provided your immune system is not
Exactly. I was actually going to ask about that, because I mean, they say some bacteria fight other bacteria, right? So the bacteria in the mouth, is it all the bacteria in the mouth that are actually harmful to the body?
No, they're not. If they were harmful, if they were all harmful, would have come out with some serious you know, disease conditions and all that. But in a situation whereby your immune system is compromised, let's say you have a reduced immune system, that's when you might start having some bacteria or some viruses, you know, causing harm.
Okay.
But naturally, they're just there in the mouth, they're just not doing anything harmful. We even have them on our skin.
Yes, we do.
So they're just not harmful.
The head, they're not harmful. But then again,
but they could be harmful.
But they can be harmful.
Yes, they could be harmful.
I mean, the ones that are meant to protect.
Yes, they could.
How though?
Like I said, with compromised immunity, they could be harmful.
Okay.
And you know, like for example, let me give a situation. Let's say dental caries, cavities in your mouth.
Yes.
Naturally, you have this bacteria in the mouth.
Okay.
But you have a lot of factors that will come into play that will cause you to have cavities.
Oh, okay.
You get what I'm saying?
Yes, I do.
So some people are more susceptible to cavities, while some are not.
Okay.
Due to a lot of factors, not just the bacteria factor.
But it is contagious.
Yes, it is.
Okay. What about chewing stick? Because this was what my co-presenter had to. I mean, he just had to mention it that day. That okay, if toothbrush is, you know, you can get some bacteria with toothbrush. What about chewing stick?
It's the same thing.
Even if, you know, chewing stick, it has two sides. You use one side.
It's the same thing. It's still the same thing, because the chewing stick is still doing the dirty job of removing the dirt, the bacteria from the, you know, how it can be while brushing. And someone else picks it up and using it. It's still about the same thing.
Okay, so I really want you to educate us this morning on how we can properly care for our toothbrush and even our mouth. How should we brush? Because a lot of people, you would agree with me that they brush wrongly. Some don't do it well, some overdo it, right? Some believe in using hard toothbrush, that is only hard toothbrush that can do the job.
Yeah.
You know, I want you to educate us, how should we properly brush our teeth? How should we care for our toothbrush also?
All right, so I'll start with care for the mouth.
Okay.
Ideally, you should visit your dentist at least twice a year.
Twice a year.
At least twice a year. For some people, it could be more.
Okay.
So when you visit your dentist, you know, they're able to pick every disease condition that's just starting. Let's say a hole is just developing. They're able to pick it up at that time before it progresses to a stage whereby you might lose your teeth.
Yeah.
So you visit your dentist twice a year, and in that process, so they also do professional cleaning called scaling and polishing.
Scaling and polishing.
So what this does is that, you know, for some people they say, oh, I brush my teeth, why do I need to come to you to clean? But over a while, you have this dirt in your mouth that have hardened, that your toothbrush cannot remove. No matter how much you brush, it's just not going away. For some people, it's yellowish, whitish, some is even green or black.
I've not seen green.
Yes, you will just notice it.
But I think I've noticed the black, but I've not seen green before.
Yes, it could be greenish. It's commoner inside the mouth. For some people, you know, they pay attention to the outer surface and they're not really brushing the inner surfaces. So when you come to dental clinic, the dentist does what? They clean off all those dirt. So one thing that dirt does is that it could cause bad breath. So for some people, after the professional cleaning, you just notice that this bad breath has stopped. Except the bad breath is coming from within. You know, you have some other systemic factors that could cause
the bad breath.
So, and also, this this plaque, what the dentist is removing is called plaque. Or calculus. That's the hardened plaque. It could also predispose to caries, dental cavities.
Okay.
So once you remove all of those, your mouth is clean, it's healthy. So, and again, you should also change your toothbrush like every 3 months.
Every 3 months. Please change your toothbrush every 3 months. Don't use your toothbrush for 1 year. Please, it's not advisable.
It's not actually. Or when the bristles, you notice that the bristles on is flared. By then, toothbrush is really not doing anything.
Yes, true.
So you should change it. Or let's say you have an infection, let's say you have sore throat, you have cough, change your toothbrush right after that. Because once you've treated it and you're using that same toothbrush, you could reinfect yourself.
Very true.
So just change your toothbrush after that. Then you use a medium toothbrush for adults, not hard, not soft.
Okay.
Soft are for children. Soft bristles is for children, but medium bristles, not too hard, not too soft, is for adults.
But why do you think people, create hard toothbrush?
Maybe they just think hard toothbrush will remove the dirt more.
I used to feel like it's for washing jeans.
Actually, I mean, it's really like, it's that hard. Like it's like you're scrubbing the rug or something.
I bought one time like this because I was also in a hurry, and my goodness, it was extremely hard. If I had used iron sponge, it is better. This one was so hard, and I was wondering, my mouth is not Jane now. It's not as if I want to scrub the life out of my.
You just damage your gums and your teeth at the end of the day. So use a medium bristle toothbrush. So when you come into dental clinic, we'll use a model to teach you properly how to brush. Because for some people, they're just brushing haphazardly.
Yeah.
And you're not doing anything. And again, it's not really how long you brush
for
that makes your mouth clean. There's a technique to it. There's really a technique to it. So it's not like some people are brushing for like 5 minutes. It's too long. 2 to 3 minutes is just fine.
And no matter how much they brush, it's not as if the teeth will turn white though.
No. You're just going to damage your teeth and damage your gums. Actually.
Okay, but would you say that hard to brush, like it's okay for people that smoke to take to use hard toothbrush to brush their teeth?
No, really, for those that smoke, the reason why you use hard toothbrush because they have stains from the nicotine. It has stained their teeth, so they feel with the harder toothbrush, they're able to remove those stains. It will most likely not go. So that's why we advise you come into dental clinic. The professional cleaning, removes those stains.
Yes.
Effortlessly. So for those that smoke, they might have to come in more often.
But it's not painful. The process is not painful.
It's not painful.
I'm considering it actually.
No, it's really not painful.
Just
at the first time you do it, because you've never done it, you might feel uncomfortable. But subsequently, you get used to it. It's not painful at all.
So you said twice at least in a year.
At least, like every 6 months. Just give it that interval.
Okay, so Dr. Uraola, I want you to do a demonstration for us now. How should we brush our teeth? Like a lot of people do not know how to, and I know you've already explained this, but I feel like a demonstration it will guide people on how to properly brush.
I'd have come with a model then.
Don't worry, you can use your hand.
Yes, I could use my hand. Okay, so one thing we should pay attention to is that there are like the number of surfaces on our teeth.
Okay.
We have the outer, the inner, and the chewing surface.
Okay,
the outer, the one we see when we smile.
Yeah, this one.
Yeah. Yeah, the inner one and the chewing surface. Yeah, this the tips of our teeth. Okay. So when you're brushing, you would in your head just try and group your. Let's start with the upper jaw.
Okay.
From back to front. Let's just position the teeth. Let's say I'll take 3 teeth first.
Okay.
I'll clean those 3. Then I'll move to the next 3. Move to the next 3. So it's because your toothbrush, the head is really not big.
Yeah, it's not that long.
At once. Yeah. Yes. So what you do, you brush the outer surface. For the upper jaw, you brush your upper teeth out. You brush it down. Don't brush your upper teeth up.
A lot of people do that. Okay, so you brush it down like this.
Exactly.
Because people do like this.
No, if you do it that way,
some people do like this.
No, there are many techniques. So I'm just giving you teeth. Okay. Yes. So you brush the upper teeth down this way.
Okay.
Now, if you look at my hand, my wrist is rolling.
Okay, like this.
Yes. So you're like sweeping it out.
Oh, okay.
So, if you're brushing it inversely this way, your gums will start receding.
Interesting.
So when you brush the outer surface out, the inner one too, you brush it out this way. You brush it. Then the chewing surfaces, like the cusp, the tips of your teeth, you make sure you brush it. The lower jaw, the reverse is the case. Brush the teeth out.
You brush the teeth out.
Yes.
From the lower jaw.
up, down.
Up, down, up,
Yes,
down. Okay.
up, down. Don't do this.
Okay.
This.
Okay.
The inner surfaces and chin surface.
Interesting.
Yeah, for some time it might be somehow because you're not used to it. But subsequently, when you keep doing it, you get used to it.
Okay, so before I let you go, what is your take on using mouthwash?
Okay. Mouthwash is not bad to use mouthwash.
Okay.
But you have to be careful when using mouthwash.
Okay.
One thing you should notice is that mouthwash does not substitute for toothbrushing. You must brush because you have those things that they are stuck on the teeth. So you must mechanically remove them. Mouthwash just rinses out, just like you're rinsing out your mouth. You are not actively removing those dirt. And while using mouthwash, you have to be careful. Let your dentist prescribe for you.
The kind of mouthwash?
Oh. Yes, because there are some that they have antibiotics in it.
Okay.
So you shouldn't use it for too long. Just a certain period of time. Let's say you have ulcers or you're having gum disease, they prescribe that for you, and you now start using it every time. No, you are just going to well, how would I say this now, reduce the immunity of your mouth, so you have those dangerous bacteria coming up more. You're supposed to use it for that period of time, and that's it.
So it's not something you should use consistently.
However, there are daily mouth rinses you can use. There are some for just that don't have that high concentration of antibiotics that you can just use daily, but it should not substitute for your toothbrush. Okay,
so but you should brush, then you can use it.
Yeah.
Okay, so there's this write-up we actually saw online one time like this, and the write-up says when you brush, you do not rinse your mouth. You have to leave it for like 10 to 15 minutes before you can rinse your mouth, because you're removing the work of the toothpaste now, right? I mean, they said that the toothpaste is supposed to perform its work before you can even rinse your mouth. And a lot of us, we just brush, rinse our mouth, we're good to go. Because according to the write-up, it says that we are still, the bacteria that was supposed to be killed or something is still there. So no matter how much we brush, the moment we rinse the toothpaste away from our mouth, we cease to let it do its job. So what's your take on this, really?
Well, I think for the not rinsing out, it doesn't really have to do with the bacteria. It has to do with the content of the toothpaste.
Okay.
Yeah, so the toothpaste, ideally, we should use toothpaste that contain fluoride.
Yes.
So what the fluoride does is that it forms a bond with the saliva in your mouth.
Okay.
That reduces your risk of having cavities. So for some people, they're like, okay, once I brush, I don't rinse out. For some, they won't rinse out. But for me, I'm not comfortable, like I have debris in my mouth, and I can just rinse out once. I don't have to keep rinsing and keep rinsing and keep rinsing. No, you can just spit out. Why some people, they just spit out and that's fine. They feel they're okay. So I just think it depends on preference. Some people, the toothpaste irritates them.
Yes, it does. Some toothpaste is...
Yeah, so it depends on your preference. So you don't have to rinse for too long. You understand what I'm saying? You can just rinse once and you're fine. For some, they'll just spit out and they
that's
feel
it.
Yes, and they're fine.
And it's okay.
It's okay. It's okay.
Wow. Okay. I know I said last question, but
no, it's okay.
What about those that, would you say it's advisable to store your toothbrush in the toilet? And because even we have toothbrush anger, because a lot of people made this for us to put our toothbrush in it and probably hang in the bathroom or something.
Yeah.
Now, I believe that your toothbrush can be exposed to a lot of things.
Yeah.
So would you say it's actually okay to, put your toothbrush in a bathroom? And if not, how then can we store our toothbrush?
Okay, so I think the issue with the bathroom is that the bathroom is usually moist.
Okay, yes.
Yes, and after using your toothbrush from your mouth, some people don't even rinse their toothbrushes well and all that. So once you are done brushing, try as much as possible to rinse it out very well. Then make sure it's standing upright so that the water drains.
Okay.
Because once you have water stored up in toothbrush or is moist, it houses bacteria, so you have more bacterial growth there.
Why then do they create cap? This cap for toothbrush?
Yeah. For example, if you're traveling and you don't want dust on your toothbrush, so you could just cap it up.
when
put
it
in
is
your
dry.
bag. Yes, once it's dried, yes, you have to make sure it's dried. Then cap it up, put in your bag so it doesn't mix up with dust. And again, in the bathroom, ensure that where you are keeping your toothbrush is not close to your toilet seat. So that when you're flushing the toilet, splashes and all that doesn't
get
splash.
on the toothbrush.
Yes, so it should be like away from the toilet.
Well, I want to ask, do you believe, because I used to see all of those adverts that they used to put out there, that when you brush your teeth, white teeth, does it actually make, like toothpaste, some toothpaste, or toothpaste generally, do they make the teeth whiter?
Yeah, like that's like a broad topic.
Interesting.
Yeah, teeth whitening is really broad. Yes. Okay, so, well, for some toothpaste, you know, they would have put, there are some things in toothpaste that could make your teeth whiter.
Okay.
But for some people, they naturally have this this colored teeth that it's not it's like, how would I say, like that's how the teeth is
right from birth.
Yes, let's say right from birth. So no matter how much they use that toothpaste,
it's not going to work.
It might not just work for them. So we could just do another procedure for them to have a brighter and a whiter teeth.
Okay.
Yeah, for some people. However, some might even need to go further and do teeth whitening procedure to make teeth white.